and they need to see that they are making progress as well. People always get concerned about how do I get my patient to buy into this? It's like, hey, how about being successful?
Good morning. Happy Tuesday. I have Neuro Coffee in hand and it is perfect. All right. Tuesday, clinic day. So we're going to be kind of busy today. So we got to dig into this Q&A for today. This is with Zach. So I've talked to Zach a couple of other times, and I interact with him every Thursday morning on the Coffee and Coaches conference call, 6 a.m. Don't forget, Thursday. And this is going to be a really, really good call for younger coaches and therapists who maybe are challenged by the interaction element of working with clients and patients. It is the hardest part. So we can talk about structure and ISAs and intervention and exercises and all that kind of stuff. And obviously that's very important because that's a big part of what we do. But the most difficult portion is working with complex human beings. And so that's what this call is about. This is about how to establish your process, how to understand the difference between what you're asking of the client and what they think you're asking of them. So there's always a disconnect between what you're trying to accomplish and what the client thinks you're trying to accomplish. So we talk about how do you get client buy-in under these circumstances? How do you set the expectations? And then how do you interact throughout this process? So this is a huge call for a lot of people. It'll be very useful. So please pass this on. If you know a young therapist or a young coach, this is going to be a big Q&A for them. So please enjoy the call. If you'd like to participate in a 15-minute consultation, please go to askbillhartman@gmail.com, askbillhartman@gmail.com. Send me a question, put 15-minute consultation in the subject line so I do not delete it. Don't forget to go to the YouTube channel and please sign up and subscribe for that as well so you get first dibs on all of those videos as well. I will see you guys tomorrow. Have a great Tuesday.
We are rolling and clock has started. Zach, what is your question?
All right. So I think it was in one of the previous consultations. I forget the gentleman's name. It was the sternum one where you're talking about string instruments.
Oh, yeah. Mm-hmm.
And one of the things I think you said in that video was like sometimes like you could be doing all the right things, but like you just need to be doing more of it. So that kind of got me thinking. Like I think there's easier scenarios to know that you're on the right track. Like some people just respond really quick, and I'm a PT, so like pain was a lot of time what we're going after. So like they respond really quick, and you kind of know you did something right. In like those trickier cases where I guess like, and again I'm thinking of like the ACL case I've talked to you before. Like she's had graft site pain for 5 months. By the time I kind of started these types of interventions. So obviously I'm not expecting that to just go away overnight. So I guess kind of like, what are some other things that you can look at, or like, what are you kind of considering to let you know that you're on the right track besides just the restoration of relative motions? And I guess some of this might just be experience, but.
Yeah. So the patient typically comes to you to alleviate the pain. But we can use that to assist us in making some decisions, but it's not the ultimate decision maker as to what we can influence, because pain is the decision that their system is making. So while we have an influence, it can't be the end result, because again, we don't get to make the final decision on that. The thing that we can do is to restore or offer the greatest adaptability to whatever system that we can impact. And so that's why restoration of relative motions, as we would measure them as a therapist, is sort of our guide as to what's going on. And so you always have to keep that in mind. As much as we want to help people and to alleviate the reasoning for them to be coming to see us in the first place, it can't be our guide, right? That's the patient's guide. And so when it comes to our outcome, we have to accomplish everything that we possibly can from our perspective, and then whatever happens, because there's people that you will be able to help, and then there's people that you will not be able to help. And then maybe you're not the solution. And you have to accept that fact too, which is, you want to be their solution, right? I mean, you want to be the guy that gets to help them, because we want them to feel good. We make ourselves feel good when we do good things. But ultimately, the guide that we have is the stuff that we can measure and the things that the patient can accomplish in those circumstances. But we don't control the pain. And maybe there's something else wrong that is allowing that symptom to perpetuate that we have no control over. The example that I typically use, so let's say you have 12 subsystems in your body, mm-hmm. and the treatment that you provide addresses 7 of those. So you restore adaptability to 7 out of 12 systems. But what if one of the remaining 5 is the causal system? So you did a great job in making a change. It's something that you could probably measure in regards to an outcome, but it didn't touch the system that's the limiting factor. So therefore, the treatment appears to fail, even though you made a successful change. Maybe it's something that you can't change. But again, sometimes you just have to invest. Always remember that there's a disconnect between what you understand and what you want to see for an outcome, and then the patient's understanding. They're not coming in educated in regards to the perspective that you have. All you have to do is instruct a patient on how to execute an exercise, and then ask them to send you a video 3 days later of them doing it without any instruction at all. And you will see the disconnect between what their perception of doing it correctly is and what your perception of doing it correctly is. So there's always that gap as well, because again, we all have different perspectives and different levels of understanding. So as much as we would like everything to be perfect, and the assumption is that somebody comes in and you say, how'd you do with your home exercises? And they go, great. And then you say, well, did you get them done, 2 times a day, every day? And they go, well, right. And then, so you know that, okay, so compliance was not at peak. And then you say, show me your exercises as if you're doing them, as if I'm not here. And then they show you what they're doing, and you see the disconnect again. Right. And so there's always this process of refinement. And that's what I would encourage you to look at this as, is process. It's like, how much change can you influence at any one time? Yeah. Some of these people have adaptations that do take time to change.
Yeah. I think I appreciate it. It's nice to hear that, because I guess it's just a perspective shift, and something that I've definitely gotten better at, and just kind of what you're saying, accepting that there's just things that are out of our control.
Right.
But it's still, it's a tough pill to swallow sometimes. It's you get into this field to help, and then it's just, right. It's tough. It's tough when you can't, or you're not getting the desired outcome that you want.
Yeah, there's 2 types of constraints when you look at things. There are those constraints that can change instantaneously. So when we talk about certain types of muscle activity or connective tissue behavior, some of those things can change instantaneously. Some of those things are adaptations that have taken time to be acquired, and therefore they take time to change, right? So it's if you look at force production, I can instantaneously change force production to a certain degree, right? But putting 100 pounds on somebody's back squat in one session, pretty hard to do. Doesn't mean you can't do it. It just means it takes time, because some things have to be constructed. So I need a greater density of the myofilaments, right? I have to have more stuff in the muscle cell that can produce more pressure. Therefore, then I can increase strength levels, right, over time. That's something that has to be constructed. It would be like somebody walking in to your clinic and saying, hey, I want to train for the Boston Marathon. Have you ever run before? No. It's like, okay, go run 26 miles and you'll be ready. It's like, no, it doesn't work like that. So you have to, some of that stuff, mitochondria have to be constructed. You have to have enzyme production for oxidative metabolism, et cetera, et cetera, et cetera, right? So you have these adaptations that take place over time. Some of those things are what people are bringing to the table. Some of those things can change instantaneously. So you have to have an appreciation for both. And that's why you say, okay, what do we need from this process, right? Change the things that you can change quickly, monitor those, and then you have to look at the key performance indicators that would be associated with the desired outcome and say, okay, what other things have to change? So if I have a patellar tendon that has been affected by surgery, which you did on that young lady, right? It's like you've got an adaptation there that has 5 months of stuff before you even get to it, right? So some of that stuff will change. Like I can change some of the muscle activity instantaneously. I can change some of the orientations instantaneously, right? But some of that adaptation might take some time. I have some remodeling that might need to take place for me to make the effective change that she's going to need to have the desired outcome, right?
Yeah, and like we are seeing some positive change. Like since I started kind of doing the stuff that you recommended, like we really haven't done like a lick of quad strengthening, and like I retested her QI and went up 10%.
Yeah.
So like there's stuff like letting me kind of know we're getting there, but like to her, like everything, like every time she comes in, it's about the pain, about the pain, about the pain.
Okay, so change the goal, right? You have to let her know that one, you care, whether it hurts or not, but you have to redirect her attention towards the process. Because if the only thing that she foresees in the future as its absolute resolution of this, then she can't appreciate the process, and then maybe she doesn't invest in it. It's like, oh, Zach gave me this exercise, but it still hurts today. It's like, okay, did you recapture external rotation? It's like, let's just say we're chasing external rotation in the hip or something like that, right? It's like, did you recapture external rotation in the hip? You have to show her. It's like, when you do this exercise correctly, we capture this, and that's part of this process. This has to come first. Before anything's going to feel better, I need to make sure that you can do this. Now she's redirecting. She's saying, okay, Zach's got me on point. I have to recapture this. This is where my investment goes. So right now, the goal is not the resolution of the pain. The goal is to recapture this, so then I can eventually resolve the pain.
You get those short-term wins.
Yes, absolutely. Because again, we understand that we have a process ahead of us. The patient doesn't, because they feel it every day, right? So their recognition is it's either hurting or it's not, right? And they need to see that they are making progress as well. People always get concerned about how do I get my patient to buy into this? It's like, hey, how about being successful, right? But being successful doesn't necessarily mean full resolution of all the symptoms that they came in. Being successful is, let me show you a measure that's limited, that's interfering with your ability to do what I think you need to do. So you show them, so you measure them and you show it to them. You do an intervention and then you improve that and you go, great job. That's exactly what we needed to happen first. Now we can do the next thing, and now we can do the next thing, and now we can do the next thing. And so again, make sure that they stay process oriented, so they understand certain types of the higher intensity methods of exercise in certain gyms. You understand what I'm saying?
Mm-hmm.
Okay, they changed the rules. That's why they became so popular. The rule the goal was no longer the result of a long-term training program. The goal became, try to finish this workout. And if you do, congratulations, pat on the back, little dopamine hit, see you tomorrow, we'll do this again, right? You have to kind of create a little bit of that yourself. You have to say, yes, I understand that you want to resolve this. Yes, I understand you want to come back to play your sport, but here's what has to happen. So you set the expectations for them. You say, this has to happen, then this, then this, then this. And I know you want the one way over here, but we have 6 things that we have to acquire first. Get the first one. That's your goal. Nothing else. Focus entirely on that. Accomplish that task. Then we can go to the next one.
Yeah, that makes a lot of sense.
Yeah. It's hard. You know, I get to sit here.
Easy.
I get to sit here in my little corner of the house and tell you how this is how it should be. And it's never going to be this straight line kind of thing, right? It's always going to be up and down. There's going to be emotions involved, and there's all sorts of interference, all sorts. And sometimes we're the cause of it. Yep. Right. But from a principle-based approach, start to establish that process. Make your patient, your client aware that this is a process, right? Change the rules so they realize that the goal is ultimately the resolution of their problem and restoring their ability to do whatever they want to do. But you got to do this first. And then help them to be successful doing that. Okay.
That makes sense.
Yeah. Anything else I can do for you? We got a couple minutes if you got them.
Yeah, so I guess kind of like we'll kind of stick with this case, I guess. But so goal still being like getting those connective tissues to be able to yield and like be
Yes,
more
sir.
compliant.
Yes, sir.
But then like in the case of like a post-op ACL, like still need to work on plyometrics at some point.
At some point.
Yeah. Is that like completely interference at this point where she's still having pain with these types of activities? Like,
Well, do you think she's going to behave normally with pain?
normally in what sense?
Do you think that she'll be able to execute effectively and efficiently if she is feeling the interference of pain? So from a recruitment standpoint, from a position standpoint, do you think she would have any pain avoidance behaviors if you gave her something that was painful?
Definitely. But I guess
Okay.
like,
Are there positions that she can acquire where it doesn't really bother her that much?
yeah.
Okay. Is there other ways to induce frequency and velocity and variability into those connective tissues without having to jump around and bounce around on a knee that's uncomfortable?
Yes.
Absolutely. Okay. So use those, right? Because you understand how vibration and waves work, right?
Probably not to the degree that I should.
Okay. If I throw a medicine ball at you and you catch it, right?
Yeah.
Okay. Like, and you stop it, there's this waveform that goes through you into the ground, right?
Mm-hmm.
Okay. So if I put her in a position that she can tolerate, so let's just say I put her in a shallow split stance and I have her doing medicine ball throws. Do you think that process is not going down through that extremity into the ground?
That makes sense.
Is that not graded exposure?
Mm-hmm.
Right? It's not as violent her jumping across the ground as we would say during plyometrics. But is that not the same process? Can I not start to expose those tissues to a lighter stimulus and then progress that over time?
Yeah, it's still like a preparatory activity.
Absolutely. Does that make sense?
Makes sense.
All right, brother. I got to run to the next call. Good to see you.
Your time as always, Bill.
All right, man. Have a great day.
You too.